Now why this bag only? Because this black material, or the material that we use to pack the material, is actually to prevent the direct or indirect light from the sunlight. So it's again sensitive to the blue light, but not really the yellow light or the white light that's inside the room or inside the office, but it's definitely sensitive to the sunlight, right? So if I would open this and keep it outside, in 5 seconds it start getting solid. So we rather not keep it outside, but always this bag would help. If it is any other bag, it's not helping because this is the custom made bag that prevents even sunlight as well. So that's how the product is made. That's how it is. I'll ask Sophia to take over from here from the application standpoint. She's really good at it. She comes with experience or in the background with ortho technologists, past 12 plus years. She has been working directly with lots of orthopedics.
And what I mean by that is that there's no leakage. If there's any leakage or it's damaged, then we want to put it aside, let the distributor know, then they'll let us know, and then we replace that. Key important thing for that is because if any of the resin is leaking, we don't want it to affect the skin, especially with the light. So very important to do that. It is very stretchy as well. So it's about that 10% you can stretch. So key with that, you want to make sure that it stays diamonds and not turning circles. So that's another indicator to help guide. And then when you're doing the measurement, you're going to refer to that table. So depending on the variant, say it's going to be the short arm, it says to measure the palm circumference and then from the wrist to the elbow. For most of the orthopedic surgeons, you're trying to immobilize a distal radius fracture, or if it's a Colles fracture, it's all going to be distally. If it's a higher fracture, proximal, then obviously the patient may be put into a long arm, complete full arm cast. So depending on what's going on, that's how you're going to gauge what you're going to need. So first thing, we'll do our measurements. If they do not fall in the table, like anything, you kind of learn to use different braces, different casting material, whether it be the stockinette or fiberglass. You kind of learn to work with what you have, and then just doing it over time, you can gauge the patient's size just by looking at their extremity and knowing what size is going to be needed. So even if that reference is off, it's okay. Most important thing for short arm is going to be that palm size, because in most of the cases, you want to have full range of motion for the patient, and then immobilizing that wrist. That's the key. So if I can have somebody to be my volunteer and I can cure the cast on you.
Small size people.
Smaller?
That's allowed, so it should fit.
What's the slimmest till hands?
I'm usually like a large, so, but so it goes based on the palm.
Would like to try? Anybody?
Guarding towards their arm, so we want to try to be as delicate as we can in the initial part. So making sure that it's not too tight is going to be the key. So usually I kind of guide it. If you can have 1 finger's length between the 2 zippers, that's usually fine. If it's a stretch about 2 to 3 fingers, that's going to be too tight. And so we want to make sure that that's always going to be something that you're going to be able to look at and inspect. If there's swelling, the way I do the swelling, similar to when you're fiberglass casting, you tend to pull a little bit more tension behind the fiberglass because you know atrophy is going to happen. You know that that muscle tone is going to go away within a couple days. So you have to make sure that you're molding correctly. Zipper. Next. This is the newer size, the newer zippers that we have. It's plastic. The metal zippers, they had a little bit of a fidget, so you have to make sure you're holding it. And so the tips, we don't want the patient to help us, so this is where I'm going to show you. So tips and tricks using the pinky, so you can use these little holes and kind of bring it together. And you can let go, yeah.
So do you need a chair?
No,
Okay.
that should be fine. Okay. I just don't want to block everybody's view. Okay, and so it's very easy, this zipper. You just connect it, bring it down. Another key is making sure that we are not running against the skin where we're going to be doing any pinching. So out and away, and that's it. So before anything, we want to make sure that the patient is in the right position and mobilizer is in the right position. So anything that we have to do, like if I want to make sure that the patient has full range of motion, you can bring the mobilizer down to get that good palmar crease. And so that way they have full range of motion, especially if the zipper is kind of running over this knuckle. Usually patient doesn't feel that zipper, but we also have these foam pads that are almost like strips, which we can underlay under the zipper line. Especially if, say, there's any ulnar deviation, that zipper line's gonna get a little bit closer. So either way, when it cures millimeters above from the zipper line to the resin. So the patient shouldn't feel it, but that is an option. To begin, we're gonna make sure that the patient is in the correct position. So normally if my doctor tells me just to put on a short arm cast, I just put them in a neutral position. If there's any deviation, or if I have to make sure that there's a specific mold, that's what I make sure. This is the foam. And I'll show you how I kind of throw the foam in. I start the zipper and I feed it through. It's a little bit easier doing it this way versus trying to hold it and put it in at the same time. And so then just kind of feed it through. And then that way it's padded right under that zipper. So if there's a deviation of the wrist, it's going to bring it up a little bit. Also, what you can do when you're curing is fold, tuck it in, and it almost like gives a little bit more space from the zipper line to that palm, to the base of the pinky. Okay. Okay. So as far as curing, most important parts that we need to pay attention to, especially like even in a fiberglass cast, any brace, want to make sure that that thumb has full range of motion. So making sure this rib, sometimes on certain patients, it tends to curve in. So to avoid that problem, what we'll do is almost like a C shape, pull up and towards the patient, and then pull out, up and towards me. And so that way, if the patient ends up picking at that foam, that is not going to be an issue for the patient or coming back to the clinic, because there will be no rubbing, okay? So now I know everything's set. I know that the immobilizer is exactly where I want it. If I want to create more space, I can also stick a finger in, but when I'm running the light over it. So I'm going to put my finger in because I want to make sure that he has full range of motion. Also, tell the patient, do a high five. There you go. It spreads it out, and then it gives that clearance for that patient. I like to begin at the back of the wrist, and then at the same time, I want to make sure that my pressure spots, these spots here, are going to be taken care of first. And so what I'm going to do is I'm going to get the glasses. I'll give my patient the glasses and myself glasses. Anybody else who is in the room has the glasses as well. And like Smith said, it's a blue light. It's just a high intensity light, so just don't look directly at it, and you should be okay. Does anybody want any glasses, or anybody have epilepsy or anything like that? Just to be safe. Okay, so to begin, I'm going to start my pressure point. And the reason I'm not coming for the front is because the light's going to shine anywhere that light's hitting, right? And that's going to start that curing process. I'm going to come from the back side with my light because I want to make sure my 2 pressure points are going to be taken care of. So key for how far away it needs to be from the immobilizer, I usually say it's 3 to 4 fingers. The closer you are to the immobilizer, the warmer it gets on the outside. So you may not be able to manipulate it, but with gloves, you don't even feel the heat. It's almost like a fiberglass cast. And that first beat takes a little bit longer, 8 seconds, but you can feel the hard already setting. Now I'm going to move to the back of my palm. I am applying a little bit of pressure, so I make sure that that's getting a good mold there. And I tucked my finger in to give me a little bit more clearance on the fingers. Do you feel any warmth on the inside?
Yeah,
a little bit? It's hard already. Now, I'm going to move to my front. I want to make sure that my palm, any gaps that we have that naturally form, those are going to be points where they hold moisture. So the closer we are on the extremity to any of the skin, we want to make sure that we're closing those gaps. So a little bit of pressure. The key with working with FlexiOH is that you don't treat it the same way with fiberglass. With fiberglass, when you're trying to get a good mold or a hold, we put a lot of direct pressure and force. And for seconds to minutes, depending on how it's activated, right? Either water or if someone does soap or spray bottle. This one, to get a mold, all we're doing is trying to move that resin where we want it to go. So light pressure, just enough to get that hug. And so at the same time, I'm kind of moving my thumb around, my finger around, so that under my finger, that resin is hardening. Now I'm going to move to the inside my wrist here, and I am applying a little bit pressure because I want to make sure that whenever he's rotating or turning his hand, there won't be no rotation in that wrist, kind of stabilizing it. And then if atrophy happens, they won't be able to just slip it off. I'm constantly feeling for any soft spots. You want to make sure that anywhere it's still soft, you go back over it with the blue light. Even with fiberglass casting, I'm always feeling if I'm missing anything just by touch. Zipper line. You can tug at the zipper line, say if there's any waves running through. So what I mean by waves, kind of like this, we don't want any waves in the cast, because then we're going to have pressure points running down. So to avoid that, I pull on that zipper line. And then that way that won't be an issue. Okay. And then at the top of the FlexiOH, we want to make sure we come in at an angle, especially if the patient has their arm towards their body. We don't want to miss the tops because that's usually a little different kind of, it's not just straightforward where the light's going to hit it. So coming in at that angle to make sure all those tops are done. And then the same thing, just filling around. And then making sure that your patient is comfortable still, that there's no problems, it doesn't feel too warm. If it's starting to feel too warm and the patient is a little bit more sensitive to the light, you can take pauses in between of the curing process. You okay?
Yeah.
It's warm, but not so hot that you can't keep your hands on it. And that's it. That's pretty much the whole process of it. And then if there's any still soft spots, you just go back with the blue light. Any questions up to this point? End of it, you can just trim it with just a pair of scissors. And this is just if it's needed under that zipper line. Questions? Did it tighten up or
Yeah.
just got rigid, right?
Yeah.
It doesn't shrink or tighten. Yes.
Can we mold it now?
Sorry. Mold it. So if you, like here, I did a little bit of mold into the palm. It was just pressure.
No, where you like to the position. No, they like now, I can't.
You can. You can't once it's set.
No, after infusing the light, they can't.
Yeah, no, you cannot reverse
I can't.
this one. No, no. So any position that the patient needs to be in, get them in that position as close as possible. Once that light is shined over it, it's cured. It's set.
So I cannot use it for closer reduction.
Not recommended, but splinting or slab splints, I know there is some countries that do more reductions with the slab splints versus this, just because of that swelling. In traditional casting, you can bivalve it, so you open it up on both sides and then allows swelling, and then you can tighten it. This one, if the patient says it's too tight, you can have them open it. And so it does relieve a little bit of pressure, and then but it's not gonna just fall apart. It's still gonna be intact until it's removed. So see, even now, I can, if I really wanted to, I could take it off. But if that is the case where the patient has swelling, they can do that, like a unilateral bivalve. You guys wanna try it?
I have questions for
Yes.
you. What if, for example, any pressure points and
Let me close it. If the patient lives alone, I would tell them not to unzip it all the way because then it's gonna be hard for them to zip it back up. But if they have somebody to help. Okay. All right, so if I needed to create a window, what the key with these here, they're just like the bone cutters, or if the nail nippers, I don't wanna rip this box here. Okay. Same concept. And same as every other product, it comes with the instructions for use. The power with these is gonna be in the end. They're not like scissors where you're gonna wanna cut like this. You wanna go direct in only to the ribs. You don't wanna get this close to the skin. It is curved now, so that way you don't pinch the skin or clip anything else that you don't want to. And so cutting, I'm gonna say that I want a window in this area. All it is directly into the rib, and then making sure you're at the end of the nail nip, the pliers. And that's all it is. It's just cutting where you want that window. And only far enough, we'll do right here, Only far enough to get into that rib. And then regular scissors, just to cut so it looks nice and clean. You can tear it out and it'll be okay. This side here. And this would be like if you needed access to sutures, wound care. If there's any sharp edges, you can get a nail file and kind of just smooth it out. But if you look at it, it's still raised away from the skin. So this shouldn't bother the patient. It shouldn't be a problem. Another thing that you can do when you're cutting, if you're going directly in, it doesn't leave these jagged spots. Even then, they're not really pointy or sharp. And then you have access to anything that you need to get to. And windows can be cut anywhere except for this lining of the zipper or on the outside. It kind of disrupts that integrity and the strength of the cast. And like he was saying about if there's pressure points, say that he had tightness here or it felt like it was a little bit snugger, you could just cut the rib and then it just releases a little bit of pressure where it feels a little bit hotter, but it's like I was touching it and holding it with my hands. It's nothing compared to fiberglass. And then the Exos, is it black and it has a little dial? Is that what you're using?
So no,
Oven?
he's talking about
different-
opening the
cast.
white
okay.
colors cast.
The
That's
white